Lack of full knee extension due to both weakness impairments and stiffness impairments can be quite problematic. It's a common clinical impairment that we see in the clinic on a day-in, day-out basis. Load intolerance, meniscal degeneration, and subchondral bone irritability is also a big problem that we deal with in the clinic. A great way to deal with weakness impairment and to maintain a reduced loading environment for the tibiofemoral joint is the toe touch weight bearing terminal knee extension exercise, and it looks something like this. We have the patient pre-tension a TheraBand and go into a split stance. At this point, I'm in a toe touch weight bearing position, my knee is slightly flexed. I now use my quad muscle to isotonically strengthen my quad and maintain a reduced load environment across my menisci and across the subchondral bone of the distal femur and the proximal tibia. This is short arc isotonic strength building for the quad in a reduced load environment, and don't forget to incorporate and intersperse isometric strength building, again in this reduced load environment. Now that's one way to deal with weakness impairment that's adversely affecting knee extension. Now, while we don't advocate that patients step over a TheraBand, I'm going to do just that. And I'm going to turn and face 180 degrees in the opposite direction. And now I'm going to have the TheraBand passively, with the elasticity of the band, pull my knee into knee extension. So I flex against the resistance of the band, and then I let the inherent elasticity of the band pull me into knee extension. And in this way, we have an assisted knee extension motion in cases of posterior capsular shortening that might be limiting knee extension in a stiffness impairment.